Hello, my name is Debbie Bell, and on behalf of the Franklin County Health Department, I'd like to welcome you to Working on Wellness. We are pleased today to be talking about a subject that is very close to my heart as an employee of the Franklin County Health Department, and that is our comprehensive school nursing program. Many of you out in our audience today may not be aware of our school nursing program and the fact that we are only one of a handful of communities within our state that has a registered nurse in each and every one of our schools in Frankfort and Franklin County. This service has been pivotal to students that have special needs or special health concerns that have previously made it where they have been unable to go to school, to leave home to go to school. And now with a school nurse in each of our facilities, they are able to come to school and receive some of these nursing services on site during their school day. I am so excited for you to meet some of our team today. Our first stop on our school tour today is at Franklin County High School, where we are meeting our school nurse supervisor, Michelle Searcy. Michelle, thanks for talking to us today.
You're welcome.
Tell us a little bit about, or give us a little bit of history behind this school nursing program.
The Franklin County Health Department has assisted with the school health program in the independent school system since the early 1990s. With the county school health program, it started about 2009, and they had maybe 1.5 nurses. And since then, we have added nurses yearly, sometimes 1, sometimes 2. But we can officially say that we will have a nurse in every building starting this year, and we're excited about that and being able to provide services to all students.
That is really terrific, and one of those first-time things that everybody's excited about. Now, with these services that are being provided, how is this program being supported? How are these services paid for?
I have to say it starts with the great partnership that we have with the Board of Education. They actually contribute a small portion to the program, and then the rest of it is it's supported by billing of some of the services that we provide, and it's also our local health tax contributes to this program.
Can you give us a brief description of what a normal day in the office looks like for you?
I don't know that we have normal days. Actually, there's not even a typical day. There are no appointments, and we see students as they present with their complaints. And there are many days that it's busy and very chaotic. We address any type of health problem that comes to our doors. We actually want to help eliminate those barriers that keeps kids from getting their education. We provide interventions for acute illnesses, injuries, communicable diseases, obesity, substance abuse. We sometimes deal with adolescent pregnancy and trying to get them maybe being the first person that they share that with, so we link them to their health care. Sometimes we deal with kids with mental health and dental disease and nutrition. I have to say, I think a lot of people think that with school health, they think it's a Band-Aid station. And, and don't get me wrong, we have our fair share of those, and we have those kids that come every day that need that service. But we provide direct care to students with, like I said, injuries, illnesses, emergencies, anything like that. We give a lot of daily medications. We take care of kids that maybe have tube feedings throughout the day. We have students with trachs that may need assistance. We have students that also may need catheterization. So there's a lot that goes on during the day of the school nurse. I feel like I should say that the whole goal is that we serve as a liaison, between the school personnel and the family, the community, and the healthcare providers. And I think we are a huge part of that child's case management of whatever disease, illness that they may be experiencing.
Michelle, what do you feel is the single most valuable component of the school nursing program?
I think that we're advancing the well-being, academic success, and lifelong achievements of our students. I think it was said best by Jocelyn Elders, who says that you can't educate a child who isn't healthy, and you can't keep a child healthy who isn't educated.
Very wise words. Is there anything else that you can think to share with our viewers before we hit the road and meet the rest of your staff?
I would just ask them to take an opportunity to go by and see the school nurse, introduce themselves, and if they ever have any questions in regards to their child's health or things that may need to be done for their child at school, to just be sure to contact us.
Thanks, Michelle. We very much appreciate your time. Know you're busy, and we look forward to hearing more about this later.
Thanks for having us.
Our first stop on our tour of school nurses is 2nd Street School. We're really happy today to be joined by our own nurse, Natalie Looney. Hey, Natalie, thanks for joining us today.
Thank you for coming to visit.
This is a great office that you have here. It's very bright. It's very welcoming. We've already seen several of your new friends walking by. And I thought we'd kind of start with just some basic questions about the school nursing program and the job that you are performing here for these students. So I guess first I'd like to ask, knowing that you've been in both an elementary school this year and previously, and you've worked with high school, tell me a little bit about how the delivery of those services differs.
It's a lot of the same services, no matter what age the kids come in. They're not feeling well. They might be a little bit nervous because they don't know what to do about it. So it's not a whole lot different. I do spend a little bit more time trying to find out from the younger kids, like the kindergartners and first graders, what the actual problem is. It takes a little bit longer, a little bit more patience to kind of, find out, it's okay, we can talk about this. It's not a big deal. But otherwise, it's pretty similar services between the high school kids and the smaller ones.
Neat. Tell me a little bit about the paperwork that's involved in a visit. I guess what I'm asking is, are there consent forms? How does that work in order for you to deliver this treatment? Are these things that are provided to students in a welcome packet at the beginning of the year? Is it with every visit? How does that work?
Yeah, so with our services, since we are health department employees, we do provide consent packets or consent forms to every student. We have to have these returned to us for us to be able to even, see the student and provide services. Usually the schools have been really good about including those in their beginning of the year packets. So we do a pretty good job of getting those back, and if we don't get them, then we're just constantly communicating with parents, letting them know that we're here, that we want to make sure that we're providing good services. So we do have consent forms, and then we also, depending on the student, if they have any type of health condition, especially allergies, severe allergies, asthma, if they have diabetes, then we have an actual action plan that we'll get together with the parent and the doctor. So there's several papers that are involved in that. Anytime a parent brings in medicine, then school nurses are the ones making sure the parents fill out all their school forms, but they're actually consent forms that we need in the school to be able to give the students the medicine that they bring in from home. So that's all the paperwork that we have to coordinate with parents. And there's also the school nurses, we're basically a clinic, so we're doing billing. We have all of our charting documentation that we do, and those are all health department forms that we maintain throughout the schools, and they also coordinate with the health department with those forms.
Now, you were talking about some of these students that maybe have chronic conditions, such as allergies or other conditions that they may, come in with. Is there follow-up with their primary care physician if they see you for, an immediate situation? Is there something of that nature or a process that's in place?
Yes, there is. We will refer students. A lot of times majority of the time we talk to the parents directly, and we'll just discuss, they really need to see the physician about this. This seems to be like a worsening thing. there are times when we actually call the doctor's office and discuss with them what the treatment plan is, just to make sure we're all on the same page. Because sometimes families, it's overwhelming, and they think they've got it under control, and maybe they don't. So we try to help be a liaison. We call doctor's offices trying to get orders for different things. Sometimes parents have they have an EpiPen, but they lost the label. So we'll call the doctor's office and just explain to them we don't have a label. We just need a doctor's order on this. So we'll fax things to doctor's offices. We call like Cincinnati Children's if we have students who are being followed for diabetes. They're really great about sharing with us action plans that we use in the school that they would use at home also, but we just make sure we're all on the same page together. So we have a really good, doctor's offices are really good about talking to us and making sure that we understand what's going on also.
That's such a terrific example of that team coordinated care approach. So it's always been one of my favorite programs through the Franklin County Health Department, the school nursing program. So with that said, what would you say is your single, either your favorite part of the school nursing program, or what's been your most memorable service that you've provided?
I think my favorite part is I like to explain things to the kids, like whether it's hand washing or bug bite or just the smallest thing, just explain to them like the process of if you scratch a bug bite, it's going to get infected, and that's because your fingernails are dirty. And I just really like watching them kind of look at me like, oh, I never thought about it that way. So my favorite part is just talking to the kids, just making sure they understand, if you have asthma and you're coughing a lot, you need to come find me, or you need to, call me, and I'll come down and we'll sit together and we'll do a breathing treatment or an inhaler, just kind of making sure the kids are really aware of like what's going on in their bodies and what they need to do to help it feel better. That's my favorite part, I think. Just spending time with the kids and just talking to them about their health and things they can do to make themselves feel better. And sometimes it's just drinking water. Like, did you know drinking water is going to make that headache go away? So it's things like that I really enjoy. Yep.
Well, that would be my favorite part too. Yeah. What a great opportunity. Natalie, thanks for your time today, and we look forward to hearing more about the school nursing program later. Thank you.
Thank you.
I'm visiting the Early Learning Village now, and this is our school for our youngest of children. We house pre-K and kindergarten kids here at ELV. Joining me now is Anita Johnson, our school nurse. Anita, thanks for joining me today.
You're welcome.
This is a great looking office that you've got here, that you are able to deliver these school services for our youngsters. And I'm awful glad to be here visiting. A lot of times I don't get to see all the places that you guys work, so this has been a good opportunity. So talking a little bit about our school nursing program. We have been on tour today visiting with some of our different sites, being that we have a nurse in all of our public schools now. And I guess one of the questions that I was a little bit curious about is, with the school nursing program, we always think about the services that we're going to provide for the children in the school. But do you ever see faculty or staff in addition to the kids that you see?
Yes. I have had to bandage up a couple of staff members. We've actually had to send one to the emergency. Have done some blood pressures and blood sugars for it. So we do see them.
That's wonderful. That's a wonderful connecting piece as far as that continuity of healthcare is definitely concerned. So on that same note, when you're providing these services, how long does it take to provide a single service?
Well, some days it's a Band-Aid. That may not take very long, and some days it just depends on what happens to the person. We've had emergencies. We've had different things. It may take anywhere from 5 minutes to 35 minutes or more, depending on what they do. And they can get creative with some of the things they do.
I bet they can. So that's definitely a good example of how it's not the same day twice. Developing a routine is tricky. Now, oftentimes, kids are going to transition just naturally when they move from elementary school to middle school to high school. But oftentimes we'll have kids that move throughout the school year. When you create a medical record, seeing as how we provide clinical services on site, What happens to that medical record? How do you connect those children back with the services that they've already received at one site?
That record travels with them. So if they go across town to another school, that record goes with them.
Now, do we have a system in place that makes that easy, as we don't have the electronic medical records yet?
Yes, we do have a system in place, and we're also streamlining that system some too at the health department. And so that we have a support staff that helps greatly with this.
I think sometimes when we think about, nursing on site, it's, you see the end result of it. The child or the staff is taken care of, but it's those little things that happen behind the scenes, like on the cooking shows on television, that you don't realize to really make it come together. Well, is there anything else that you can think that our viewing audience would like to know about the nursing program?
Just that we do several. We may have tube feeders. We may have diabetics. It's more than just a Band-Aid a lot of days. So we do provide services so that the kids can come to school.
And we're grateful that you're there. Anita, thanks so much for taking the time to talk to us today.
Thank you.
Our last stop on our tour of schools is Hearn Elementary School, and joining me now is our school nurse, Missy Cincy. Hey, Missy, thanks for talking to us today.
Thanks for having us.
We have been visiting several of the different schools within our community where we are so fortunate to house our school nurses, and we've talked about a variety of things as it relates to the school nursing program, and I'm certain many of our viewers have information now that they were really not aware of, just bringing light to some of the things that happen, in our schools every day. So for you, some of the questions I would say for you is, since the beginning of the school nursing program, have you noticed any changes as far as how school health is delivered and how this partnership works?
I have noticed, in my opinion, the partnership is stronger. It is a true collaboration between the nurses and the school. Our goal is to keep the community healthy. The school system's goal is to keep the students in school, so we both work together with that, and it's really developing nicely. We have a higher attendance rate, and students are staying healthy.
Definitely a huge goal that's set there. I've been asking all of your coworkers that we've talked to today, what is the single most important part of your job? Or what is your favorite thing that you do through school nursing? So I want to throw that at you. What do you think is the most valuable piece of your job?
I love taking care of the kids. I love helping a child when they're sick and making them feel better. But, our goal is keeping the kids in school. So, I love that we're able to get kids who are healthy back to the classrooms. And the kids who are truly ill, have a fever, vomiting, we do send them home. And, that's just it. We keep the kids here that are healthy. And I think that that makes the students smarter, and I feel good about that.
Is there anything that you can think of that the community needs to know about the school nursing program that maybe before you even started working as a school nurse that, kind of came to light or an aha moment about this program in general?
I think there's a misconception that we do just give out Band-Aids and all that kind of stuff, but we really are here doing a lot of the healthcare needs for these children, and just the idea, like I said earlier, keeping them in the classroom. I mean, that's just, has become not as much of a focus as to keeping them healthy, but at the same time, it makes us feel good about our program. We can, take care of a child, they feel better, and they leave my room. It makes me feel good about myself, and I love my job, and I hope that we continue to have this program in Franklin County.
Well, I hope so too. And Missy, I want to thank you for taking the time to talk to us today and to share this information with our community.
All right, thank you for having me.
Thanks. And I want to thank you all for watching today. I appreciate the schools allowing us to come in and visit these fabulous areas that they allow us to work in every day. I'd like to thank our nurses for talking with us today and sharing with you some of this maybe new information on the school nursing program. If you're watching the WoW program for the first time, I hope you tune in again next time. And if you have a topic that you would like to see us discuss for Working on Wellness, please feel free to contact us at www.fchd.org. Thanks, and see you next time.